Hey everybody, Gray Stallman here again. Welcome once again to another episode of The Doctor Is In Live with TOA. It's Friday again. Awesome. Thanks everybody who's been following us on these Facebook Live episodes. I hope you find them interesting. Again, this is an experiment for us. This is really for you. I'd love to be able to get you information that's important or interesting to you. So please feel free to communicate with us either live if you're here, or if you're watching this after the fact, send us a little note and give us some comments, feedback. We look at the comments on Facebook. Give us information about what you'd like to hear. Again, my name is Gray Stallman. I'm an orthopedic spine surgeon here with TOA. I've been in practice almost 25 years. I will tell you that except for Carlos Johnson, I'm probably not your spine surgeon. Hi, Carlos. Make sure that you realize that this information that we're going to talk about today is really not medical advice. We're just talking. If you have a problem, you need to seek out qualified care. Certainly you can find musculoskeletal care anywhere. We'd love if you would come to TOA. Go to www.toa.com. It'll tell you about our practice. It'll tell you about our docs. It'll tell you about our services. You can even make an appointment online. So if you're having a problem, let us see you and let us see if we can help you. Again, I'm a spine surgeon, and most of what we've talked about up to this point has been related to spine surgery and spine problems. We are going to be branching out in the next few weeks of having some guests on where we're going to be talking about other topics. So I think it'll be a lot more interesting than looking at this face all the time and talking about just spine stuff. So I'm not going to be here next week. I'm going on a little trip, but I'll be back the following week, and our topic then will be what to expect when you're going to have surgery and what happens in the operating room. We're going to talk a little bit about kind of the process of getting to the facility, what's going to happen, what you should expect, and what may happen and what you may see, okay? For those folks who've never had surgery, going into the operating room or the hospital is pretty scary. It shouldn't be. But I'll give you kind of an explanation about what to expect. And this will apply not only to spine surgery, but just surgery in general. So I hope you tune in. Again, that's not next Friday. It's going to be the Friday after, again at noon Central Time. Today's topic is a little bit more of a thought process topic. It's very technical, and I'm going to try to make it as simple as possible. But we're going to talk about something that's been in the news a lot, something that you may have seen a lot of advertising for as far as trying to help manage chronic back pain problems. And what that is stem cell treatment for musculoskeletal problems. We're really going to focus on the spine, but some of this applies to other areas of musculoskeletal care. So what are stem cells? So this is a biological treatment. And I'm going to caution you before we get too deep in the weeds. This technology is really new. This technology does not yet have a track record of knowing whether it helps or doesn't. This technology is not approved by the Food and Drug Administration, the FDA. We're seeing a lot of people advertising regenerative medicine, stem cells, PRP, which is platelet-rich plasma, for a variety of applications. And actually, in a few weeks, we're going to be talking to Dr. Christian Anderson in our office, who's a sports medicine doctor who actually does work with PRP, not in the spine, but in other parts of the body. And we're going to bring him on to talk about PRP and where we are in the state of that technology. So if you've gone through some of our previous episodes, We've talked a lot about where people get with their back and why people develop back pain or chronic back pain, and much of the causes are related to degeneration or wearing out. The natural process of aging and breakdown can lead to pain problems. And obviously, that's frustrating for people who are undergoing these processes. It's also frustrating for us because we don't have a way to reverse the degenerative process. Since pretty much the dawn of time, humans have been looking for that fountain of youth, if you will. Basically, some way to reverse the process of aging and make us essentially invincible. It's never going to happen, but there are some technologies out there that may help us to at least slow down that process. Ever since I've been in training and in practice, the holy grail has been to find something that we could inject or apply to the spine to help undo the degenerative process or regenerate the structures like the discs or the joints, and hopefully help decrease people's pain or improve their lifestyle. That's been the holy grail. They've tried everything, and it's still the holy grail. We don't have the magic bullet, okay? Stem cells are just the latest possible treatment option in that long line of magic bullets. What are stem cells? So stem cells are natural cells in your body. The magic about stem cells is that they are essentially what we call non-differentiated cells. They basically are just basic cells in your body that have the potential ability to convert themselves into specific types of cells. So for example, cells that make up skin, or cells that make up bone, or cells that make up discs, or cells that make up the blood-forming bone marrow. Theoretically, anyway, a stem cell can be urged to develop into one of these specialized cells. Well, that would be awesome if you could truly control the stem cell's pathway or fate. You could create new, young, presumably, cells that might replace or rebuild parts that have worn down. That's the theory. Stem cells come from many parts of our bodies. The most common places that stem cells are retrieved from are the bone marrow, fat, some other tissues like muscle. The more controversial stem cells, but the more powerful stem cells come from either infants, such as the umbilical cord blood, or even embryos. Now, the embryonic stem cells, at least in this country, are not legal. The government has decided that obtaining cells from an embryo is basically a fertilized egg that has the ability to grow into a human in the right conditions, is not ethical. Okay, so we can't do that. Typically, the traditional way stem cells have been used early on are to try to help people with blood and bone marrow cancers, such as leukemia, to try to help them restore a more normal blood and bone marrow system. And so we'll take blood or bone marrow from somebody and process it, try to concentrate the stem cells, reintroduce it in, and treat the stem cells to try to educate them to become more normal blood-forming cells and reintroduce that into the body. So that's probably the earliest work in the human for stem cells. But as with just about anything that doesn't have hard data and science associated with it with regard to actual treatment or clinical efficacy, how well it helps the actual person, not just in a lab experiment, things can get misused. Again, stem cell treatments are not FDA approved. There are very small studies that are just coming out where the FDA has approved the use in a very limited way for stem cells. In the spine, that has been stem cell treatment in somebody who has a spinal cord injury to try to regenerate the spinal cord. There's been very, very, very small studies in injecting stem cells into a disc or into the spine itself to try to help improve people's pain. And when I say small studies, I mean maybe 10 patients in a study. 10 patients is just a drop in the bucket. That does not tell us that this modality, this treatment, is widely used nor a gold standard. So in the spine, basically stem cells, the theory behind them, the desire of using them, is to try to either help regenerate worn down and degenerative discs, the rubbery shock absorbers that sit between the bones that allow us to move, or the joints. Those are really the two main areas of degeneration that we would love to be able to reverse to try to help people's pain. The disc is the primary, okay? So with that said, there are no studies out there that definitively say that stem cells of any origin are absolutely guaranteed to help improve your problem, okay? It's way too early. The science is just in its infancy. The problem is there are a lot of people and clinics and practitioners out there who are taking this technology and offering it to the public, basically playing on the fears or anxieties of people, the desperation to get better, and offering it out there. Now, they may or may not be telling people this is not FDA approved. They may or may not be truly discussing with people how infantile our experience with stem cells is. They probably do not discuss with people that there are differences in the types of stem cells that are acquired from the adult body, various body parts. Again, bone marrow, muscle, fat are probably the top three. They're offering these treatments, typically injections, either into the disc or the joints, and we'll concentrate on those in the spine, with no data, with no backing by the scientists that are doing the studies, for cash, because these are not approved treatments, and hoping for the best. Now, could it be that they are ahead of the curve and these practitioners are actually onto something and they're just the early adopters and they're the ones that are going to help develop the data? Yes, it's possible. Right now, however, would I recommend to my patients, if they were offered stem cells by somebody, would I tell my patient that yes, I think it's an appropriate treatment for your problem, it's proven, and it's effective? Absolutely not. I'm not even close to considering that. I'm a little bit of a skeptic. I'm pretty conservative, which means I don't just grab onto the next latest and greatest technology and say it's great. I want it to be proven. But in this situation, with really no supportive data, offering patients essentially a treatment that is unproven is very risky in my opinion. And there's a couple reasons why. First off, it may not work. Probably won't, at least in the framework that we have now. It's been very well shown that fat derived stem cells and adult human-derived stem cells are far less likely to be influenced by the various factors that can make them become any cell we want. They're probably much more limited in their ability to create a specific cell. So it's not that likely, for example, that a fat stem cell can be coerced into becoming a disc cell. Okay? Is it possible? Anything's possible. Is it likely? Not so much. Now, if we had the ability to go all the way back to the primitive embryonic stem cell, my thought process is we probably have a lot more likely ability to get those cells to do what we want than a cell that is matured and aged. The fetal stem cells may be kind of where we can, or infantile stem cells, maybe those things that we can have more influence on. We still don't know. The trouble is, if it sounds too good to be true, it probably is in the spine world. Again, not covered by insurance. Stem cell treatment can cost anywhere from hundreds to thousands of dollars. Zero guarantee. We have to keep in mind, too, that there is what's called the placebo effect. There are people who have had stem cell treatments in their spine, and again, let's just concentrate on the spine, that say they're better. There are very well-known studies of taking a placebo, basically a non-active treatment. Basically, it's like giving somebody sugar water or a sugar pill instead of a medication. And they seem to get better or improvement. Maybe 30, upwards of 50% of people will say they got a positive response to a placebo when it makes zero sense, when they weren't getting treatment. Why is that? The mind is a powerful thing. How we feel is not just based on physical, but also emotional. And the placebo effect is really the concept of I want to get better, I hope I get better, I feel like I'm better. And I think that in this situation, in my opinion, the placebo effect is more the mental side of how our general health is. Well, if somebody's getting an experimental or non-proven treatment, such as stem cells, and they spend thousands of dollars on it, there's a pretty powerful incentive for that placebo effect to come into play. And so I wouldn't be surprised if a number of people said they felt better. What we don't know, and again, I'm an open-minded person, but what we don't know is, in reality, do these treatments actually create a difference reliably? We don't know this, okay? Now, so other than the financial or just going through it with injections and whatnot, negatives on stem cells, one kind of scary thing about stem cells is there is at least a theoretical and probably a fairly real possibility of developing a stem cell that actually morphs itself into a bad cell, like cancer, okay? This is a big theory. This is a big concern. This is where we want to be really cautious, because what you don't want to do is let the genie out of the bottle and get into trouble with something that you can't put back in the bottle. And so there is a concern, in my opinion, of whether or not treating people with this type of technology can potentially cause a very harmful problem. Again, we don't know all the details. So it's an exciting theoretical technology at this point, in my opinion. There's lots of people working on various levels of stem cell research to try to understand, can we manipulate these biological devices to become tools for our good? I don't think that we have definitive clinical data, meaning how it affects the actual human being, to support using these on a regular basis. I think we have some increasing amount of basic science, the lab and the theory that suggests this is an avenue of possible hope, but we're not close to having a definitive answer on this. I would not recommend to my patients to spend the money or time with stem cells treatment for their spine pain just because I can't back it up with science. Again, could it be a treatment that is useful into the future? Yeah. I mean, that's why people are researching it. But we just don't have the information yet. So this is, to me, and again, my opinion, my soapbox, this is, to me, the modern day snake oil. People are selling this technology without the ability to definitively back up its use. And it's a little bit preying on people's hopes and dreams in this situation. So I'm very cautious about the widespread claims of the fabulous benefits from stem cell therapy, at least in the spine. Now, in our visit with Dr. Anderson, he's going to be talking about a little bit different biologic technology called platelet-rich plasma. But I'm also going to bend his ear about his experience and his knowledge about stem cells being utilized in other body parts, such as the knee or the shoulder, ligaments, that type of thing. So it'll be an interesting kind of segue to his visit. I will say that one last thing, in spine surgery, we do use stem cells in a roundabout way. Many physicians, including myself, do harvest bone marrow from the patient and add it to the bone material that we put in the spine to fuse their spine together. The theory there is that if we can get some of those cells that are either stem cells or the proteins that are growth factors that are more rich in the bone marrow to help increase the growth of bone in the area where we're trying to fuse, the hope is that that will improve the fusion rates. It's not specifically harvesting stem cells. It's not processing or reprogramming stem cells to become bone cells. But it's an easy, simple, non-risky way of maybe augmenting their likelihood that they're going to get a fusion. So it's something that many surgeons do. I do it. It's basically trying to use a belt and suspenders approach of doing everything we possibly can within reason to try to maximize the ability to get the outcome we want. It is not trying to regenerate body parts. It's trying to augment this artificial environment to help the body do what we want it to do. So I will say that in that regard, stem cell treatment is used, but it's a very specific thing, and it's not the type of stem cells that we've been talking about, such as obtaining it from your fat and injecting it in your spine and hoping to get a brand new disc. Anyway, a little bit controversial. I tried to keep it as simple as possible because there's big words involved with this that I can't even pronounce. There's a lot of research out there that's being done. This is an exciting area of biologic treatment that may be able to provide us with lots of benefit. Right now, I think mostly it's just theoretical. We haven't established how much stem cells could help us and in what situations. So anyway, I hope this has been helpful. Again, if you have any questions, comments, either go on Facebook, leave us a comment. We look at all the comments, good or bad. I appreciate them. If you have more questions, you can get a hold of us on www.toa.com. If you have any kind of musculoskeletal problem, we'd be happy and honored to help you try to get better. A little personal note. My last episode, I talked a little bit about chiropractic, my thoughts on chiropractic. I had a very nice immediate response from a chiropractor in Murfreesboro who gave me some information to think about. I appreciate his input, and in fact, he offered to host me at his office to see how he does things, and I've taken him up on the offer. I'm going to go down and spend a day with this chiropractor and try to learn a little bit more, try to educate myself a little bit more about what he can offer my patients. So I appreciate that opportunity. I think that this is where social media can really be beneficial. So I look forward to that. I'll report back on my experience there and see what I learn. Anyway, again, I'm not going to be here next week. The following week, we're going to talk about what happens when you go to the operating room in surgery. Go visit www.toa.com. Visit us on Facebook. Look for other announcements for this educational tool and other educational things we have on social media. And until then, go out there and live your best life.